Starting this week, more Coloradans will have access to a vaccine. On Friday, Coloradans 65 and older and teachers can begin getting vaccinated. By March, Colorado should be ready to start vaccinating essential frontline workers like grocery store clerks. Now, more than 130,000 Coloradans are already fully immunized with 2 doses of vaccine. Our 7-day average positivity rate keeps trending down, now sitting just under 5%. Still, there are nearly 1,000 active COVID outbreaks across the state right now. And one of the biggest hotspots for COVID-19 outbreaks in Colorado, residential living facilities. The latest data from the state health department shows that they make up 23% of active outbreaks right now. And some nursing home owners say that staff shortages led to those outbreaks. CBS 4's Jacqueline Quinn has been looking into this. Jacqueline, nursing home operators say they are chronically understaffed.
That's right. You know, it was hard before this pandemic, and now it's really impossible.
Before the pandemic, there was already a shortage of staff in nursing homes, but the pandemic really kind of lit this fuse and created this circular nightmare.
The Colorado Public Interest Research Group combed through Medicaid and Medicare data, and it showed that nearly 1 in 4 Colorado nursing homes had a nurse shortage. In Colorado, 24% of homes reported a shortage of nurses by early December. Denver alone was a hotspot of shortages, with 26.1% having a shortage of nurses and aides. That's higher than the national average of 23%. As concerns over COVID increase at assisted living facilities, people are turning to at-home care as an alternative.
And so Home Instead's Hiring Week's goal is to hire 90 permanent caregivers.
Home Instead Senior Care is hiring healthcare workers from Fort Collins to Colorado Springs, tapping the already drained pool.
We're helping him up. We're able to change, obviously, his clothes.
But Dahlquist says some people may not realize they can work in this field. Workers with the company help seniors with things such as housework, food, and personal hygiene care.
The assisted livings and nursing homes have had a really challenging time. People are thinking twice about whether or not to move mom into those settings.
In-home care is only one option to limit exposure for those who can live independently.
We are calling for more federal funding to go to nursing homes so that they can address their needs in terms of PPE and staffing shortages.
And groups like Colorado Public Interest Research Group also want the state to step in, especially when there's an outbreak. Another thing Allison from COPIRG says that they would like to see is more transparency, mainly who gets vaccinated, those residents and those workers at these facilities. In Denver, I'm Jacqueline Quinn covering Colorado First.
Colorado health leaders are considering another change to the COVID dial. The proposed Dial 2.0 would essentially loosen restrictions counties currently face. Now, this version of the dial is just a draft. They want your feedback on it by tomorrow at 5 p.m. We have the link to submit your thoughts at cbsdenver.com.